Clinical methodology, interviewing to study schizophrenia. Interviewing has been used to gather data about schizophrenia. For example, Gottsman and Shields, 1966, used semi-structured interviewing with participants to find out about their mental functioning. There are three types of interview. Structured interviews, they are like questionnaires where there are set questions, though these can involve both open and closed questions. It differs from a questionnaire in that someone asks the questions and records the answers directly. Unstructured interviews have a schedule to list the areas that need to be covered, but the actual questions are not set, and the structure of the interview is free-flowing so that the interview can follow the thoughts of the interviewee and can note down more varied responses. Semi-structured interviews is a mix of the other two interviews. There are set questions to be answered, but the interviewer also has some freedom to ask other questions and explore the respondent's views in more depth. Evaluation of interviewing. Strengths. Unstructured interviews tend to be valid because they allow the interviewer to explore issues that the respondent leads on. So there will be focus on what the interviewee wants to reveal. Another strength is that interviews will gather qualitative data as well in almost all cases, which means there is more depth and detail which a more structured interview or controlled method would not provide. Weaknesses. There might be interviewer bias if the interviewer's dress or manner affects the replies. The way the questions are asked can also bias the responses. Another weakness is that detailed interview data can be analyzed by looking for themes. This process can be subjective. For example, if Gottsman and Shields 1966 knew about a diagnosis for a participant, they may have inadvertently recorded data that matched diagnosis.